Good morning, everyone. Hi, I'm Robin Shapiro, and I'm the board chair of the Washington State Health Advocacy Association. It's so great to have you join us today on Memorial Monday, May 25th. Before we get going on our community conversation, I just wanted to take a moment to recognize our veterans and those who have served and also lost their lives on this Memorial Day. So I'd like you to join me in listening to a couple of quotes that I have selected to do that. The first one is from Beth Pennington, who says, "As we set today aside to honor and thank our veterans, let us be mindful that we should be doing this every day of the year and not just one." And also from Harry S. Truman, who's from my state of Missouri, my hometown, "Our debt to the heroic men and valiant women in the service of our country can never be repaid. They've earned our undying gratitude. America will never forget their sacrifices." So as we take a moment, let's just think about our veterans and take a moment of silence. Thank you. So I have started our recording today of our community conversation, which will focus on COVID-19 and also personal safety nets. We have two speakers today, Dale Reisner, who's a medical doctor and medical director at Swedish Health Services for OBGYN Quality and Safety, and she's also a WASHA board member. And we have our special guest, Denise Malm, who is a licensed social worker. She works at the Wallingford Senior Center, and she's also a geriatric mental health counselor and has had years of experience in working with people who are seniors and talking about personal safety nets. So as we go ahead, and I just wanted to do a quick check to see if Dale has signed on, which I don't see that she has. Something has come up. So we will get back to our COVID-19 check with Dale Reisner in a moment. But before we do that, we'll go right to Denise Malm. Are you ready, Denise?
I'm ready. Okay.
to talk about personal safety nets. Thank you.
Yeah, and at any time, if Dale comes on, we can take a break and then carry on afterwards, whatever works.
Sounds good. And I just wanted to remind people that we are recording this presentation that will be made available to the public. So if you don't want your video to be included on the recording, please turn off your video and please ask questions in the chat function. You can also raise your hand through the chat function for me to call on you. And I just see that Dale has joined us. So let's go ahead and go to Dale. Where are you, Dale? There you are.
Hi.
Okay, great. So Dale will go ahead and give us the review on
Sure.
COVID-19 as you get set up.
There we go.
Okay, we are recording.
Yeah. So good morning, everyone. I will share the statistics of where we're at so far in Washington State. And then I just wanted to comment a little bit about opening up and what that means and where we're at. As of the 23rd of May, Saturday, we had 19,828 cases in Washington State. And out of those, 1,061 deaths. That's about 5.5% of those cases that we know of. I want to put that into perspective. We have tested 326,000, a little more than 326,000 people in the state of Washington. And of those tested, 6% were positive. So most of the people tested were not positive, way most. And to put that into perspective, we have 7,600,000 residents in Washington State. So we really only tested 4% of the total population. And that speaks to the opening up and what's necessary to do that. But I just thought that perspective was kind of interesting, that really the majority of people that are being tested are not positive. So that's a good thing. And it does look like things have slowed, but are sort of staying steady for much of Washington State, particularly King County, where the biggest volume of cases has been. So the good news is that out of the 39 counties that we have in Washington State, some are very tiny, some quite rural, 21 of those have been approved to move to phase 2. And I'll talk about phase 2 in just a second, so you, in case you don't know, you'll understand what that means. So everybody's been in phase 1, and then bit by bit, as counties are able to provide testing and contact tracing, and businesses are able to follow guidelines, they appeal, they fill out kind of an appeal to be able to move to phase 2. So the following, that was adding Cowlitz, Grant, Island County, Jefferson County, Mason, Pacific, and San Juan recently. And they're part of that 21. And then there are 3 others that are available to apply, and the application process is very quick, and most of these counties are very anxious to get going, so they're ready to go. So Clallam, Kitsap, and Thurston are the next 3. So you'll notice that my comments are about small counties. The large counties are nowhere close, so King is not close. The good news for the eastern part of the state is Spokane is part of one of the ones that's open. But Yakima County, which had some recent cases, is not. And most of the
it's not
ready for
it's not
phase
ready.
2.
Mm-hmm.
Right. And most of the I-5 corridor, the bigger counties are not. So Pierce is not, King County obviously not, Snohomish, Skagit still are not quite there. So the fact that 2/3 of our counties are open already, and there's a few more ready to go, is really positive and really encouraging. What has to happen, as I mentioned, was you have to be able to make testing available for anyone and everyone who needs it in the county who has symptoms. So not necessarily asymptomatic, and I've spoken in the past that for elective surgeries, we are testing asymptomatic patients in most places that are opening up for elective surgeries. Staffing needs to be available to do the case investigations when somebody does have a positive and do contact tracing. And then also there needs to be housing available for isolating or quarantining people who either can't or don't want to quarantine at home. Maybe they're positive and they have an older family member at home. So alternate housing to be made available for someone who's positive in those kinds of settings, and for homeless people who are positive.
Can I ask a question about that? Because we haven't
Mm-hmm.
really chatted about that before. Does that mean that the hospital systems are trying to make alternative housing? Like, how is that?
Not the hospital,
working?
the county.
The
so
county.
It's counties that are responsible to do that in order to open back up again. Hospitals are trying to keep COVID positive people out who aren't sick still. And then case management, of course, for people that are quarantined, because that's a big deal, impact for your life to be fully quarantined and not able to, even go to the grocery store with a mask and so on. So I just wanted to review those things, and then just to highlight what is in phase 2 that's different. So still the message is stay at home and stay healthy, and definitely use your protective gear. So, masks when you go out where there's other people, keep your 6 foot physical distancing, and wear gloves or lots of hand sanitizer. And then outdoor recreation is opening up in phase 2, still with a recommendation of no more than 5 people in a gathering that's not outside of your immediate family. Limited non-essential travel is going to be opening up a little bit. And then the key things, so in-home domestic services are opening up. That's a big plus for very many of the elderly and people with disabilities that can't get around as well. So that does include house cleaning services as well as other support services in the home.
Does it include home caregiving? Like, so
Well,
I'm just thinking
yes,
about
it does
our home
that
care
out, but it
companies.
includes nannies, so it should include home caregiving for someone who's needing that, you know.
And I think that Sean D'Amelio of With a Little Help, who has a home care business, is online. Can you comment, Sean? Just type in whatever you understand phase 2 to be, so we can make sure to
there are some restrictions on retail openings, so in-store openings for those counties is allowed, but it's going to be volume and you know, those kinds of things. Office professional services and office-based businesses may be opening again with restrictions in volume of people that are in the facility at any one time. And then hair and nail salons and barbers are opening again, not with a full building, and then restaurants would be required to be less than 50% capacity, and tables no larger than 5 people at one table. So, did Sean have anything to add about the home caregivers?
In-home care is considered essential. So basically, it sounds like, I'm trying to see if I just unmuted you, Sean. Could you just comment about caregivers in the home?
Sure. We've been considered essential basically almost since the beginning. And we can go in. The challenging part has been that home care has had a challenging time getting PPE to go in. I don't know of any home care companies currently that are caring for somebody that's positive, but they will go in if somebody's had 2 negative tests. So we're kind of coming in on the back end of it. But I will definitely let you know once we hear if anybody. It's been more about getting the correct PPE to be able to go in safely.
And the good news on that too is that stuff's more available. You can go places and buy masks and buy gloves, which weren't available initially. So that's really good news for anyone, whether you're a professional home helper or you know, a family member or a friend. So I think
the other piece of that has just been that, you know, caregivers often work at multiple places. So it's been whether people want to expose their caregivers to anybody else if they're going in to see somebody. So some people have put in clauses where they'll go in and care for somebody, but they have to commit to a minimum amount of hours. If they want only one caregiver, then they have to commit to having, you know, 35 hours a week with that caregiver. So the caregiver is getting their allotted hours.
And maybe this is even a subject to go into a little bit more in depth on a different community conversation, because I think there is probably some lack of information and dynamic changes. So I want to make sure that we have time for Denise to, thanks for popping on, Sean. I really appreciate you weighing in on the conversation. Okay, Dale, sorry about that.
Yeah, no worries. That's what I was going to cover, and I'm happy to answer questions at the end if there are any. But I think it's slowly but surely, I guess, is the way to look at it, and cautiously at the same time. But our state has done some amazing things, and we just have to not get frustrated and kind of let it all go. And I think we'll continue to see improvement.
I have a question here. What will the volume restrictions be for professional offices? How might this work for multiple businesses in one building?
You know, I don't see anything laid out in the overview. I am sure that big places that have lots of open spaces are going to need to space people out. And it's my understanding that a lot of these companies anxious to get back to work that may have had people working a little bit from home, but weren't used to that, are already thinking about how they can have, especially, you know, so many places went to open settings and cubicles rather than offices. And so you may be needing to leave several cubicles separated, and you may be alternating who comes in when. And I really think that this is not a temporary change. I listened to a very interesting discussion on a webinar the end of last week that talked about what businesses are going to survive and which are not, and how the big malls, for instance, the big malls where tons of people are walking around, are probably not going to be a thing in the future. And the little strip malls that were kind of being ignored probably are fine because they have smaller places and easier to pace people coming in and out. And then typically they're facing the outdoors. So I think the larger businesses will all have their own plan, and I don't actually know if they need to specifically, as counties move into phase 2, if they actually need approval for larger populations. But you can tell by the restaurant recommendations, 5 people at a table, there won't be large meetings, that's for sure.
So Carrie Andrews says, I'm in Jefferson County where we moved to phase 2 Saturday, but our county opted not to allow all the conditions, i.e. we're not allowing in-restaurant dining yet, not allowing overnight camping, and hair and nail salons are serving existing customers only. We're trying to minimize tourist traffic from areas that aren't in phase 2 yet. So I think this is all, I think, talking about the new normal, which is, again, another topic that I think, one of the things that we're looking at, maybe bringing a speaker into talking about kind of where we are today, where we are going to be, maybe shorter term, maybe longer term. But anyway, so it's dynamic.
I hear a lot about whether schools can open. That's still up for grabs. So I do think that if we're able to be careful, then that is going to allow things to get closer to normal much more quickly. And I know every county that is large and has struggled with being able to test and track is working as hard as they can to get that to that stage so that we can move on. There's a minimum of 3 weeks in each phase. So some of the counties that went into phase 2 already need to be stable at phase 2 before they move to phase 3. So just we can talk about that in ensuing weeks.
Okay, that's great. And I'd love to, thanks so much for everybody weighing in on that. Thanks Dale, that was great. And would love to get to Denise's topic of personal safety nets. So I'm gonna hand it over to Denise. Welcome and thank you.
Yeah, hello everyone on this rainy Monday. So one of the things I want to start off by talking about is my experience with older adults. And I'm a pretty casual speaker. I'll leave that at that. You can see my hands. So, and as I talk about this, there's gonna be a common thread from where I start with personal safety nets to working with older adults or people who I like to call solo agers. So personal safety net, I started teaching personal safety net, which really is designed to build a team of people or a care team in case something happens, right? So it's a proactive, preventative framework that people can put together, and there's a workbook and you go through certain things, and with that, as I've taught that, I noticed more and more there were older adults coming who, for one reason or another, did not have what I call the social capital that others have. So for instance, they didn't know their neighbors, they had not married in their lifetime, they didn't have children. And they were really, the older adults were really looking for a way to do that and how to get creative. So one of the things in this COVID-19, what comes to mind and what I'm seeing is, of course, the medical piece. For sure, the medical piece and having documents and so forth, all of our medical documents written down, the people, our caregivers, our physicians, so on and so forth. Medications, very important. Having that one place and making sure that people know where that is. So I think in this moment, that is a big deal. And I've noticed over time that we are so focused on the physical piece, as we should. What I see missing from some of the conversations is the mental health piece, the connection. And what I know with older adults is isolation and loneliness has a huge impact on physical well-being. And the other thing that we know is as people get older, they lose the social capital. Their friends die or move. They become isolated due to transportation issues, so on and so forth. Another piece of that is in the stage of life, there is really review. If you are familiar with Erickson's stages of development, when you look at the stage of development, it really is looking back on our life and knowing that we had meaning, right? That we mattered in our life. And two things that I want people to come away with today is really making that connection with people as health advocates, as concerned neighbors, as adult children, whoever is on the conversation here. So one of the things that I have come up with is to really create meaningful conversations that are deeper than what do you think of the weather? What about this COVID-19? And so we have meaningful conversations that bring us a little bit deeper and create more of a connection socially and emotionally. Robin, I forwarded the conversation starters that I used to Robin.
And we'll make those available on our website in our resources section. So, yeah. And do you want to, Denise, do you want to give some examples of some of those conversation starters just so people have a flavor of that?
Sure, yeah. So one of the things one of the questions that I like to ask is, in relation to what's happening, is I will ask, if you were to put something in a time capsule, to document this moment in time, what would you put in that time capsule? Another one is very reflective in history is, tell me about your hometown. So often we say, hi, how are you doing? Again, it's that surface stuff. And the image that I always use, which is overused, is that iceberg image. And we see 10%, right? I mean, I can see that Robin has dark hair, she has glasses, so on and so forth. And so the idea of connecting with older adults is to get below that 10%, is to really ask, again, questions such as, tell me about your hometown. The other thing that I have, I've got so many of the questions, in a character of a movie or a book, who do you admire most? Tell me why. What were the games that you played as a child? And so I've got probably about 25 questions that are meaningful. The other piece is, how do we introduce, how do we use this? And Robin and I had talked, and I've had these conversations with other people, is so often what I'm noticing right now is people are coming out more and more through media to say, how can I help? What can I do? And it's older adults who live in a neighborhood or who live in an apartment building that are having the younger generation, I don't know if I want to use that term, but are coming out and say, what can I do? Can I buy you toilet paper? Can I bring you some food? So on and so forth. So we have that layer too, where people really want to do something to help older adults, which I love, because older adults are not in the social justice frameworks. Older adults are not seen as important in institutions and how our culture is put together. So with that,
and we have an interesting question that just came up from Joe Haley, which is, do men struggle more as they age compared to women? It's kind of an interesting take on it.
I think that they struggle more because of how men are raised. I mean, I can go down this rabbit hole, the socialization. The example that I have, Joe, is my own father lives in Arizona. He's turning 80 in July. And he often talks about his connections were through my mom, who has passed away. And one of the things that I do with that is asking, again, at these questions, if we can find someone to ask these questions. And my dad loves to talk about his time in high school when he was on the swimming team. Letting him talk about the things that mattered to him as he was getting older. And this is not, I don't want to paint with a broad brush, but changing those questions for men is often what I do to talk more about their professional career or when they were in sports, so on and so forth, versus with women, it's more about the relationships that they've had over time. And so again, getting creative, and what I like to say, it's meeting people where they're at, right? It's meeting people where they're at and finding out what was most important to them. In those conversations, we are giving messages that you are important, you matter, your life mattered. And I often end conversations with that. And I will tell you, in my experience, there is another statement that I've ever used that brings tears to someone's eyes who feels forgotten, who is now questioning if their lives mattered. So again, it really is finding different ways to connect.
Can you take us through? So when we're thinking about solo agers, and I love that phrase. I think that that's really apt. So thinking about all the different places that solo agers might be. So they might be living alone in neighborhoods. They might be in assisted living. They may be in nursing homes. So with COVID and all the restrictions and visiting, and maybe some people are not very tech savvy, how can we connect and even have a conversation if we're not able to be there? What are some suggestions that you have?
Yeah, and the technology piece has been a big deal, but again, I often work with people who don't, I call it, they are technology immigrants. In other words, that it's navigating the technology piece that is confusing. It's hard to, it's hard to read and navigate. So let's go back to snail mail. Right? The ancient art of writing a letter to someone. And with these, where I was going earlier, Robin, is with these Northwest neighborhood online communities of younger generations, it really is reaching out to them and saying, hey, what do you think about writing a letter to someone who is feeling alone and isolated? And creating that conversation with these conversation starters. And how beautiful is if you have a child who is in school age, grandchild, child, neighbor, whatever, is sitting down and teaching them to write a letter. And it can be on a computer, that is not a problem, but really opening up those questions and then creating that connection. And that possibility really excites me. And the example that I use too is there was a time that I lived with, and I have her permission to use her name, Annie, who is turning 96 in October. And what I can tell you is one of the highlights of her day was waiting for the mail. Seeing if somebody had put a card in there. I mean, even reading the ads. But it's those little things that we forget that are so meaningful and create a normalcy, is that a word?
Mm-hmm. Yeah.
To the older generation, who that's how they grew up, was the handwritten, and it can create a pen pal situation, you know. And in Denise's world, it's, you know, who's to say that these relationships don't continue? I mean, it's with hope that these relationships do continue. And I'm going to bring that back to personal safety nets, because that is also an underlying goal as people come together to create personal safety nets and get to know each other in each situation, is then continuing that relationship. And yeah, so two things that I want to show us, I don't know how much time we have, is in personal safety nets, one of the first things that we do is we create a document that is called If You Really Knew Me. And I'll show you on camera here, but there's 3 questions that we ask. What people like and admire about myself? What I admire about myself? The second question is what's important to me, which really kind of talks about the values. You know, what's important to me is compassion, it's independence, authenticity, honesty, and then how to best support me. And what I love about this document, and I'll show you as I'm talking here, what I love about this document is that it can travel with us. And so the example that I often use is if you end up in the hospital and unable to talk for yourself, if you end up in a skilled nursing home, if people during COVID-19, right, where people aren't seeing us personally, like to carry this with us and have it available for medical staff and for our caregivers, because it really personalizes and lets people know how to best support me and who I am.
And this is a great tool for advocates to help clients or people to help their family members do that in this time where maybe we can't be doing a lot in person. So I just love that. Somebody asked, is the personal safety net blueprint available? Is that something that's out there available?
Oh, yes, there's a website where you can look through it's got a workbook and different things you can click on. Absolutely.
And is that like personalsafetynet.com or org or edu? What's the website?
Robin.
Okay, I'll look it up. While you continue talking. So somebody else actually had a question about connecting with people we don't know who live in institutions like nursing homes. So for advocates or other folks that want to do that reach out, how do you suggest they do that?
It's going to depend on the facility for sure, because what we know is that some are not accepting letters for fear of COVID. It's really, again, going to be asking those facilities what can be done and check in. And it could be a adult family home. It could be so many different places. And I think the one thing that comes to mind is connecting with a facility in your neighborhood or in your community. Again, so with the idea that we can then have a personal conversation and create that when all of this is over.
Okay, it's personalsafetynets.org, and I just wanted to I just wanted to let everybody know that you can actually save the chat by going below on the right hand side of your screen, and there's 3 dots. And if you pull up that menu, you can just save the chat, and then that'll you don't have to be writing down everything that's going on in the side panel. And someone, Joanne Gainan, also asked, can you repeat the questions? We're actually going to make those questions to make meaningful conversation available to you on our website. So when this is posted this afternoon, we will also have a section for the questions that you can download directly from our website. So just go to Community Conversations on washa.org and it will be there. So there is also on personalsafetynets.org a good explanation of what the personal safety net is and the resources there. So yeah, recommend that everybody go and do that.
Yeah, and again, it's a it's a safety net to have ready when life happens. And we often talk about older adults with this, and that this is the audience that I work with. But this can also be if a military family is one of the spouses or parents or partners is being deployed. While that person is gone, who is going to be in the family's personal safety net, right? As they leave. It could be going through a divorce. It could be adopting a child. So this it's really fluid and organic and can meet anybody where they're at in that situation. So yeah, another thing that in that personal safety net, we talk about the 8 pillars of resilience, which is again on the website, and kind of looking at those different pillars that we can go to, and who can be there that we trust to, bring food or do my laundry if I've had ankle surgery, those kind of things. So one of what is often overlooked, and I'm going to say it, is senior centers, right? We don't often look at community social gatherings, organizations as part of the safety net. And when I teach this, I will say, and I am in your personal safety net. Write me down, get my number, and share this, with other older adults. And again, the relief when we go through this, you can feel it. You can feel it in the room. Just people knowing you're not alone.
Yeah, so I have a question with COVID kind of shutting everything down. How are senior centers like Wallingford Senior Center? How are you connecting people, since the in-person stuff, which has been bread and butter for senior centers, is not able to happen right now? So give us a peek into what Wallingford is doing and other senior centers that you might know about.
Yeah, we're having to get really creative. The example I was telling Robin, that Brene Brown, and I won't say it, Robin, but Brene Brown has a term called FFT, and I'm using that as a flexible first time, right? So we're really having to be creative. And in all of this, it's creativity. Yeah. So what we're doing is we're looking at Zoom, and we are, so much of what we're doing is technology-wise at this point. And what I am offering is, phone sessions with people who don't have that access to technology. And often that conversation just listening and just that connection is so important right now. So a lot of what I'm doing is that.
That seems like it would be a good strategy for advocates who are maybe have some downtime because there's not a lot of in-person work, to contact their local senior centers and other organizations to be available to do either short check-in phone calls or something like that to help support and create community.
We're definitely doing that. We've done 2 rounds, and every in all that, it's, we have a social worker available if you need to chat. And certainly in my job, what I've noticed is where people were, I've got it, my neighbors are taking care of it, my daughters, I've got it, you don't need. And my there's more and more, my job is becoming I'm busier now than I was before, let me put it that way, because people are now going, I'm losing it. Like I'm losing it. I don't know what to do. And
because
so
people are feeling so isolated.
Yeah.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah. And it's, again, it's the mental health piece and sticking in it and really just witnessing that. What is happening with older adults. And again, it's that isolation and loneliness that really is a huge struggle, more so than ever at this life stage. And the second piece that I would mention too is our caregivers, right? It's also the caregivers. I'm talking with caregivers who are just like, I don't know what to do. I can't see my mom, and it's figuring out ways to connect that we had never connected before, and letting people know that they matter, their lives are important.
Yeah. And Beth Droppert is just reminding us using phone calls and conferencing with family members is just such a powerful strategy in trying to connect people. So that's something that many people can do. And Sean D'Amelio is reminding us also that merging a call now has never been easier. And so Sean tells a great story about merging a phone call with her aunts and uncles, and how powerful that was, because they were actually not able to all talk all together for maybe many years, Sean, and that was really amazing and powerful. Mm-hmm.
Beautiful. The other thing that I would mention too, Robin, which I've noticed in my job, is the consistency of that connection really gives people something to look forward to, and being able to trust people to show up the best they can and be a person of their word. I have a woman right now in her 90s, and who says, are you sure you're going to call? Are you sure you're going to call? And what we will hear often is, well, I don't want to be a bother. I don't want to bother you if you don't have the time. And again, if you take away anything, I will say to her, you know what, your life matters, and I love listening.
Yeah.
And you're important, and you're important to me. You're important.
Beth Barnett offered this. She said, I was in touch with a nursing home resident who only uses a flip phone. Are there any ideas for helping the person who doesn't use technology partner with someone who does? Another resident or staff member. So much is done on Zoom these days. And if you don't have any facility with some of that, that can be challenging. What do you recommend in that case, Denise?
So what we've noticed, again, one of the things that Wallingford is doing is we're finding technology mentors who can walk with, talk people through that. And you have to have the technology itself, right? So a flip phone would be tough. Again, in Denise's world, if I had my way, we would be mentoring and teaching the frontline staff how to help older adults with that by
Mhm.
providing iPads, whatever, and doing that face to face. One of the things that that technology wise too, that is easy, again, going back to Annie, we set her up with Alexa,
Mhm.
and again, this is resources. Often I work with people who do not have resources, who live on $700 a month. But she is able to say, Alexa, call Denise. And so without having to push a button, without having to do anything. So that is technology. And then you have the other layer, right? Which is, how can we go in to help?
Mhm.
And right now we can't.
Mhm.
But also that's the other piece, is reaching out to a younger generation and saying, can you help this older adult somehow?
So do they have, is there anything like a reverse Big Brothers, Big Sisters for, I mean, I don't know if there's got to be somebody who's thought up a program like that.
Well, I think people think of it, and the villages have
Mhm.
been great, and people know the villages, right?
I
And
think maybe even maybe not everyone on the call knows about
so
the villages, so maybe talk a little bit about that.
the villages, it was created on the East Coast, I believe, and it was really supporting older adults to stay independent and age in place, as they say, or age in their home. And so it's a group of volunteers that say, somebody knows how to do light plumbing. Someone is younger and can get up on the roof and clear the gutters. Someone can come in and possibly do laundry. So it really is a group of volunteers that, when an older adult um, is at risk of falling or whatever, or doesn't have the ability, let me put it that way, to maintain those things to stay in their house, they have a group of volunteers that come out.
So that would be another, like I know in our Seattle area, I think there are 4 senior villages.
I think
So
there's
there's,
5. There's another one up in North Seattle
okay.
starting
Yeah,
to.
so Northeast Seattle Together, Finney Neighborhood Village,
Mhm.
East Side Friends. I can't remember. Mary Pope is on the call. She probably knows what it is.
Network.
What is that?
Eastside Neighbors Network. I just posted something about what we're doing. And
Okay, thank you, Joanne. I was like, I know it starts with East Sides and it has to do with friends.
There's also
Those neighbors.
Friends. There's also Eastside Friends of Seniors, which is a different organization and serves further east, which is kind of neglected territory, from what I've heard. A very powerful organization.
Yeah.
Gotcha. Thanks for popping in here, Joanne. And I think it's what I love about what Denise is saying is there are some real tangible things that advocates and neighbors can be doing to support your local area and also stay connected with people and support people. So that's very tangible. Letter writing, being available to do phone calls, and understanding what either senior centers or some of the assisted living or other areas are doing, because they may be open to some specific help to support those in isolation. Are there, just speaking of the mental health piece of this, are there mental health resources specifically for seniors that we should know about?
Well, it depends on what you say, what you mean by mental health resources. We do have, there are people who are geriatric mental health specialists. I'll give a shout out to the other senior centers here in King County. Most of them, not all, do have social workers who are also being creative in all this and trying to figure out how they can best support older adults. And I would say in most, you know, and I'm going to talk about social work because this is what I know. It's like these concepts in understanding, meeting people where they're at, understanding the lifespan that they're at, and the mental health piece. Mental health is always worked in, always a part of what we do. The social workers that I know, and again, we're all busy. So there are community mental health organizations that have older adult specific mental health specialists, and again, licensed social workers or LMFTs, so on and so forth, who have that experience and that knowledge in working with older adults. I always encourage that, always.
So yeah. So I also have another question. So I'm thinking about the adult child that lives across the country from mom or dad or grandma, who is experiencing maybe some cognitive decline. And how can we support that person in that situation now that it's maybe a little bit more difficult to either visit or have them, you know, be evaluated for dementia, Alzheimer's decline, that kind of thing?
You're talking about the adult child or the care receiver? The
care receiver, but I'm thinking if you're across the country, is there a way for the adult child to help the senior get those services? Or if they don't have an adult child, how best to kind of evaluate that in this particular time?
So I will use the personal safety net approach, and often I do work with adult children whose parent is another place and they're worried about them, so on and so forth. And we go through and we map out who is in your mother, your father's personal safety net, right? Do you have a neighbor's number who has eyes on them? Or do you have the facility? Do you know who is there? Do you know of videos that you can watch to understand what is happening? You know, I have to say, and I'll give a shout out to my colleague, Karen Mack, who is a good person that you can consult with, who knows cognitive dementia or whatever inside and out from a social work perspective, and knows geriatricians who know this and know about the brain wellness. And so again, it's gathering the resources, because when we're often in crisis, we're not thinking straight. Some of us, not all of us. Again, I don't want to paint with a broad brush, but it is putting those things together that create an ease and at least something that we can rely on.
I'm just wondering if because a lot of people are not having regular doctor visits, and not having kind of the regular check-in that they might, I'm wondering for those, considering that dementia is such a huge, overwhelming thing in our aging population, like how is that getting done in the time of COVID? And I don't know, Dale, if you have anything to contribute here in terms of, you know, that seems like that would be a big problem that's maybe not getting addressed at the moment.
Yeah, and it's huge. And I would say it's absolutely huge. And again, who has eyes? This is what I always say, is who has eyes on this person on a regular basis.
But if they're not able to be, you know, people are not going out, they're not interacting with a lot of people. So Dale, do you have any?
My only comments are that I'm not aware of anything that's sort of organized, but my comments are of a general concern for especially for the solo living elderly person, but also for people with other chronic illnesses. And that's that fear, I think, has overwhelmed logic, and what's the right thing to do. And you know, it's super interesting to me to see the extremes of what some people are doing, you know, scrubbing down their vegetables and all these things before they will, you know, let it enter their mouth. And yet others are walking around with no protection, sneezing, coughing in your face, you know.
Yeah.
I think when you are appropriate, you shouldn't be afraid to interact. No, it shouldn't be millions of people through the home, but your comments, I think, Denise, about a personal safety net are super important. Those people or that one person that's close by in the safety net ought to be able to go in and visit that person in the home.
Dale,
And
thank you for saying
afraid of the
Thank-
what?
Thank you for
Yeah.
saying that.
Oh, yeah, yeah. And always should have been able to do that, because there's more to existence than somebody dropping your groceries on your front step. And I think that isolation, you know, especially if there are, you know, areas of dementia or, you know, sort of failing hearing, which is a huge problem. And isolates people, that face-to-face is hard to beat. So I do feel like all of the cautions have been appropriate, but we've had a really typical in life. We have this pendulum swing way too far one direction, and we need to get back to center. Maybe not to normal. We need to get back a little bit more to center and think about what is really important for this person right now. How can I do that safely and not give up that human contact piece? And I think we're seeing that with kids being isolated from their peers, and you know, they're starting to see depression come out more with kids. I just think that we are going to have to realistically figure out how to build those contacts when people don't already have them in place. So I'm super thrilled, Denise, that you and your, you know, other social workers, especially with the elderly population, really reaching out to get them to create those personal safety nets, because like, who doesn't need that? You know, yeah. So I don't know anything medical community could do other than trying to really let people know that it is safe to come to the hospital when you need to be in the hospital. Do not wait until you had your heart attack at home. Do not, you know, do not do those things, because people are being really careful. And the same sort of thing with visiting somebody that's a select person, not 50 different people a week. And I love the idea of the dedicated hours that you talked about, where it's one person working every day to get their 35 hours. And actually, that's probably a better model than anyhow, you know, for building a connection and making that person feel valued instead of you know, a new person every other day.
Dale, can I add on to that real quick? And I'm conscientious of the time, is in working with older people too, and I want to bring this back to a medical model, is I often see things in risk and protective factors, as we do with the heart model, right? You want your protective factors to be higher than your risk factors. And so coming up with protocols for people, such as, you know, wearing a mask, how many people have you been in contact with in the last 3 weeks? Sanitizing high touch areas, you know, staying 6 feet away. So creating, and so that's also how I try to frame it with people. If they want to go see somebody, is as long as your protective factors are higher than the risk. And let's take a look at what the medical, the CDC and professionals are saying with that. So,
well, I think that's a great way to end this very powerful talk. I just want to thank Denise Malm and Dal Reisner for really providing a wonderfully rich conversation. And we will also, this was really great. And we will also be posting on the WASHA website in community conversations, Denise's suggested opening questions, which are really, really great. I had a peek at them. And so those will be posted a little bit later today. And just thanks everyone. Have a wonderful, safe, happy Memorial Day. And we will see you back here real soon. Take care.
Bye.
Bye.
Thanks,